Welcome, everyone. As rehabilitation professionals specializing in work-oriented neurorehabilitation, our ultimate goal goes far beyond the clinic. We want to help our clients reclaim their lives, their careers, and their education after a brain injury or stroke. Today, we are going to walk through the Return to Work Blueprint. We will explore Chapter 6 of the DCAT 2 Professional Manual, and we will review real-world clinical case studies. These cases will demonstrate how to use the dynamic, complex assessment task to bridge the gap between clinical measurements and the sometimes unpredictable dynamic demands of the competitive labor market. Before we dive into the specific cases, let's look at the two major clinical purposes of the DCAT-2 system. The first major purpose is objective job matching. We use DCAT to safely compare an injured worker's current abilities to the specific standardized demands of their target occupation. It provides the objective data needed to guide return-to-work strategies, identify necessary accommodations, and, when necessary, clarify their occupational disability. The second major purpose is fostering psychological adjustment. When clients experience a recent brain injury, they often lack awareness of their new limitations. The Progressive Occupational Demand, or POD system, provides a safe environment within the OT clinic for clients to confront their executive dysfunction. It allows them to adjust psychologically while collaborating with you to develop effective compensatory strategies. Let's look at our first case study, which illustrates bridging the gap to the worksite. Mariana is a 43-year-old aircraft assembler recovering from a concussive brain injury. Initially, she lacked confidence and her assembly speed was severely impacted. During her 2-week return to work program, her OT used DCAT situational assessments on an increasing demand basis paired with passive video recording. Through video debriefing, Mariana realized she was over-relying on the assembly manual. The therapist gradually handed the review process over to Mariana, teaching her to self-coach. This process helped her correct her errors, rebuild her confidence, and ultimately led to a successful supervised return-to-work trial and the resumption of her competitive employment. Our next case involves Tomas, a 39-year-old electrician who sustained severe burns and an anoxic brain injury. Tomas's primary challenges were task switching and multitasking, skills critical for a busy electrician. By utilizing DCAT situational assessments and increasing levels of demand, the occupational therapist was able to pinpoint exactly where his cognitive load capacity maxed out. With this data, the OT helped Tomas adopt better organizational strategies. Rather than sending him back to a highly chaotic construction site where he might fail, the DCAT results mapped a safer blueprint. Tomas transitioned through a supervised return-to-work trial in a less distracting environment, eventually achieving self-managed employment with specific restrictions on task complexity. Slide 5 brings us to Albert, a 21-year-old motorcycle mechanic with a mild traumatic brain injury and cervical spinal strain. Albert struggled significantly with frustration tolerance. Initially, the therapist administered a high-level assessment, Situational Assessment 11, which resulted in severe confusion and anger. This was captured on video. The OT used the video to provide constructive feedback, helping Albert grow from what he initially judged to be a failure. In the next therapy session, the OT stepped down the DCAT demand to SA5, which Albert completed successfully. Through weekly progressive assessments at varying levels of demand, the DCAT served as a therapeutic tool to help Albert practice frustration management in real time. This incremental approach worked beautifully. Albert returned to his prior employment initially with the support of a job coach, and eventually transitioned to working independently within the physical limitations imposed by his cervical injury. On slide 6, we look at how the DCAT helps when a return to work isn't possible. Douglas is a 57-year-old community college math teacher recovering from a cerebrovascular stroke, exhibiting mild receptive aphasia and dysexecutive syndrome. Doug's OT set up a 3-day work simulation using DCAT Situational Assessment 12. While Douglas's physical assembly skills improved, the addition of the telephone message interruptions revealed a persistent severe difficulty with message transcription. This objective data clearly documented a significant mismatch between his oral comprehension abilities and the complex demands of teaching. This DCAT-informed evaluation provided the defensible evidence needed to support Douglas's application for Social Security disability insurance benefits, giving him and his family improvement in their financial peace of mind. Our final case highlights the second major purpose of the DCAT, psychological adjustment. Jane is a 17-year-old high school athlete with a concussive brain injury who exhibited severe problems with frustration and anger. During DCAT Situational Assessment 8, working under time pressure triggered sometimes severe verbal outbursts and impulsive actions. By having this happen safely in the OT clinic rather than in a classroom, the therapist was able to use video debriefing. Over a 6-week outpatient program, Jane used the DCAT to safely confront her limitations, negotiate with her symptoms, and neurologically adjust to her new reality. She successfully developed the coping skills needed to return to high school and graduate. To wrap up our blueprint, let's talk about why the DCAT-2 works so well for work-oriented neurorehabilitation. We use the Goldilocks doll chair because it leverages what psychologist Robert White called the urge towards competence. We all have the need to be competent. When we have the opportunity to develop competence, we experience hope that motivates us to participate and persist in rehabilitation, one of life's most challenging experiences. DCAT helps provide that opportunity. A stroke survivor with expressive aphasia can practice naming parts like arm or leg while building something tangible. For a client with Wernicke's aphasia who struggles with written instructions, the physical chair provides immediate, undeniable feedback, helping them cope with frustration. Engaging in a meaningful task allows clients to unify their physical and cognitive skills rather than testing them in isolation. It validates their neuropsychological findings at the same time that it helps us to provide the just right challenge that can give our clients hope. Thank you for joining me for the DCAT Return to Work Blueprint. As you take these case studies back to your own practice, remember our core philosophy. The DCAT-2 doesn't just measure a deficit, it safely maps the accommodations and coping strategies our clients need to successfully reclaim their lives. Thank you for your time, your attention, and your dedication to developing the value in each of our clients. Take care now.